Good morning, dear colleagues. The purposes of this short presentation are to present the Neuromuscular Research Lab, briefly describing our research lines, the research methods we use, and some representative examples of performed studies. Our lab investigates the neuromuscular mechanisms of human movement in three main research lines: the study of neuromuscular mechanisms and adaptations to physical training and physical activity, the optimization of methods to evaluate neuromuscular function, strength, and flexibility, and the identification of predictors of locomotor injury and changes after injury and movement disorders. To better understand the relationship between our research lines and the methods we use, it is important to remember that strength and human performance are dependent on two types of factors. By one hand, on the intrinsic factors of muscle issue, the cross-sectional area, the muscle architecture, and the muscle composition in terms of different types of muscle fibers. By the other hand, strength is also dependent on the muscle control performed by the central nervous system, specifically the neuromuscular coordination processes and the reflex mechanisms that influence muscle tension. To investigate these muscular and neural factors and to understand how they adapt to different types of training and conditioning, the research methods we use are force platforms, dynamometry, including isokinetic dynamometry, often synchronized with electromyographic signals, kinematic, kinetic, and EMG analysis, synergy extraction from the electromyographic signals, electrical stimulation, edge reflex, V-wave, ITT, and also image techniques to measure factors of muscle tissue as the cross-sectional area, pronation angle, and muscle fiber length. Then I will present some significant examples of studies carried out in our lab. We have been directing attention to the characterization of neuromuscular coordination patterns in different sport skills and to the influence of expertise, as we did in these studies with golf and karate, in order to identify and quantify coordination patterns and distinguish between athletes with different levels of expertise. We apply the extraction of muscle synergies, which can be performed from multiple surface EMG signals using mathematical algorithms. Through this method, we can identify the main muscle synergies that the central nervous system uses to control the muscle activation during a sport skill and how these synergies are influenced by training, as we did in this study that compared elite swimmers with beginners. The repetitive nature of some sport skills, as golf and tennis, leads to mechanical spinal loads and asymmetrical adaptations that are commonly associated with low back pain. We know that an increase in muscle fatigue and a reduction in co-contraction patterns have been found in low back pain patients. So, we use different techniques of EMG processing as spectral analysis and machine learning methods in order to relate low back pain incidence and changes in neuromuscular patterns in athletes as tennis players and golfers. EMG analysis has been also used in our lab to characterize and quantify muscle recruitment in different strength exercises for abdominal muscles, rotator cuff muscles, pullover exercises, or also to investigate the effects of different training methods, as we did with the sensoriomotor training protocol. We have also performed research with blood restriction training, studying its application to locomotion and evaluating its metabolic cost, investigating its acute effects in different conditions, or evaluating its influence in nerve conduction. More recently, we investigated the potential of training with blood flow restriction to induce cross-sectional effects. Gonçalo Mendonça, who led this project, will address this topic as an example of using electrical nerve stimulation on the assessment of neuromuscular function. We are also investigating the chronology of neuromuscular adaptations to strength training. We know that for untrained subjects that start a strength training program, an improvement in force is obtained soon in the first weeks, and it is assumed that this initial strength increase is mainly due to neural adaptations, and during the first 2 weeks, to adaptations in intermuscular coordination. But this is not clearly supported by research, and the main reason is that it is not easy using the traditional methods of EMG analysis to evaluate how and how much coordination changes with training. The extraction and quantification of muscle synergies can help to solve this limitation. So, Paulo Santos, in a first study, evaluated the reliability of the method, and in a second study of his PhD project, he compared the kinematic and neuromuscular coordination patterns during the power clean performed by untrained and trained subjects. Soon, Paulo will start the longitudinal studies of this project. Sexual dimorphism in neuromuscular function is another research line of our lab. Many studies reported that, regardless of being stronger than women, men are more fatigable for sustained and intermittent isometric exercise. But it is unclear whether sex-based differences in fatigability exists during higher intensity or dynamic exercise. So in a first study, we investigated whether men and women display different magnitude of muscle fatigue in response to high load exercise and low load blood flow restricted exercise. Results show that the torque decrement in response to both types of dynamic exercise does not follow a sexually dimorphic pattern. More recently, we explored sex differences in muscle fatigue produced by isokinetic contractions performed at different velocities. No sex differences were obtained after isokinetic contractions at 60 degrees per second, but at 300 degrees per second, women showed more fatigability than men. These results suggest the presence of a sexually dimorphic fatigability in response to dynamic contractions, favoring men at higher velocities of contraction. Occlusal splints have been advocated as a mean to improve sports performance based in the change they promote in temporomandibular joint. Amandio Dias conducted a research project which aimed to identify the acute effects of occlusal splints in different motor tasks as body sway, muscle activation, and shooting accuracy in pistol shooters, shoulder isokinetic evaluation, kinematic body oscillation in gait and running, and upper limb strength in rugby athletes. Future research should investigate the long-term effects of using occlusal splints. The identification of neuromuscular injury predictors is another research line of our lab. The knee is one of the most frequently injured joints in sports. Some years ago, Nuno Cordeiro compared knee kinematics and neuromuscular patterns during an instep kick between ACL reconstructed and LC soccer athletes. The findings of this study suggest that 6 months post-rehabilitation, both groups have similar neuromuscular patterns while performing this ballistic movement. Because dynamic knee valgus has been associated with ACL injuries, more recently we compared women with and without medial knee displacement. In a first study, we identified the kinematic and neuromuscular differences during the overhead squat. Subjects with medial knee displacement exhibit greater muscle activity in some hip adductors and knee muscles during the eccentric phase of the exercise. A second study used a nonlinear parameter, the sample entropy, to investigate the fluctuations of the center of pressure during single-leg landing tasks from 3 different directions. Women with excessive medial knee displacement showed an increase in entropy values in medial lateral direction. This suggests a decreased ability to adapt to external demands that likely result in an increased risk of injury. The study of variability through methods of nonlinear analysis is nowadays a key element in injury prevention and rehabilitation and will be developed in the talk of João Vaz. We have other ongoing projects at different stages of execution, some of them with studies already published. Effects of intermittent fasting on exercise performance, effects of sleep deprivation, interference of concurrent training in the development of strength and neuromuscular adaptations, and the effect of refractal-based gait intervention on gait and postural control in older adults. A last word to our post-graduation course, Strength and Conditioning for Training and Rehabilitation, that is supported by recent research and by the books that our group edited about strength training. In this course, the students have the opportunity, if they choose to continue to the master in elite training, to develop research in our investigation lines using the resources of our lab. I try to make a general picture about what we are doing in Neuromuscular Research Lab. In the next talks, my colleagues will present 3 specific topics about innovative research we are performing. Thanks for listening.